Now, the White House does expect breakthrough cases. Just recently, for example, Maryland's governor, who has been vaccinated and received a booster, tested positive for COVID-19. He is immunocompromised, Larry Hogan there, as he is a cancer survivor. Other lawmakers, we know at least 3 Democratic lawmakers also with breakthrough infections, including Cory Booker and Elizabeth Warren. So all of this comes at a time when the president is making this speech today, set for 2:30 this afternoon. And by the way, Dell, for folks who have questions about those 500 million free at-home tests, the big question there is, when can I get them? And that will be, unfortunately, after the holidays. So folks do need to be safe during the holiday, and they will have to sign up through a website and receive it in the mail. So, look, you're not going to get that for Christmas, Dale. But I would get it for you, by the way.
Sort of.
Just in case.
Yeah, supply chain issues. I knew that that's what I was getting from you guys down at the Bureau. So, Bofta Yimam for us on Capitol Hill. Bofta, as always, thank you very much. We are, yes, back in the same boat again. COVID surging in the United States. New cases, as you heard Bofta say, averaging about 130,000 a day and climbing. Here to break it all down, some of the brightest minds in politics, BNC contributor Teslin Figaro, Democratic strategist Teron Sims, and Josh Lopez. Teslin, I'll begin with you. We know what the president's going to say. He's going to say mask up, vax up, and social distance. But a lot of Americans want him to say, those who aren't vaxxed, you're going to be treated differently when you go to the hospital. Those who are vaxxed will get the first hospital beds, and their cases will be paid for by insurance. Is it time for the private sector to step up to solve this pandemic?
Well, I think the private sector has stepped up as far as they go, as far as they can, without impeding on people's constitutional rights. I don't necessarily believe in the we're going to only treat some folks who did not get the vaccination differently than those who did. The bottom line is this variant is not going anywhere, and once this is over, there'll be another one. In fact, studies show that this will be around until 2023. So we cannot continue to shut down and stop our economy, particularly right now with inflation at a record high in the last 40 years. We have to find a way that folks have to continue to do what they feel is right for them and their families. The government has to still do their part. Private sectors obviously have the freedom to do what they feel is right, but we just have to learn how to just live with this and move forward.
So, Tesla, let me push back on that. If you have school children, they have to get their shots or they don't go to school. I mean, it's that simple. As adults, why shouldn't we be told that you get the last bed at the hospital if you don't have your shot versus those that do?
Well, the reason why I don't subscribe to that is because there are still Black Americans, Dale, who do not believe in vaccination because this country has not ever cared about the health of Black people. Do I necessarily subscribe to that myself? No, I don't. But at the same time, I want to be a voice for those who are not just doing this for a political stunt. No matter how much information you give them, how much science you give them, when we talk about Black folks, this is not a political stunt. How is it that they're supposed to trust this government? So some folks just need time, and I don't want those individuals to be turned away from a healthcare system that already turns them away when they go to the hospital, that already disenfranchises them, that already doesn't provide the resources necessary that cause all those underlying conditions. So I just don't support the government impeding on folks in that way. Let's take care of our sick just like they do everything else when they take care of these big corporations.
Teron, you're a military man. In the military, if you don't get your shots, you basically don't get the cot. Do you agree with what Teslin's saying?
I understand where she's coming from on this, but also understand where healthcare workers are coming. I mean, I don't have a personal opinion on it, but with ICUs and emergency rooms getting overfilled again, healthcare workers have to figure out a way to prioritize those who they take care of. And I definitely would understand why they would use who's been vaccinated and who hasn't, their vaccination status as a means of prioritizing healthcare. So I'm not saying they should turn anyone away, but if someone comes in with some type of ailment, whether it's physical or whatever, and maybe there is 2 people and they both have the same ailment, but the difference is one's been vaccinated and one isn't, one gets taken care of and one has to wait. There has to be some level of prioritization because as one doctor in Indiana stated yesterday when he was speaking to their state legislature, they're running out of healthcare workers. They've run out of beds. They've run out of energy. Enough is enough, and people need to just start waking up and realizing that Corona is no joke.
Josh wins the award for holiday-themed backgrounds. Josh, whenever I hear talk about this, I hear talk about a shutdown, but I also hear this: don't close the schools unless you close the bars and restaurants first. Your thoughts?
Yeah, I think shutting down the country is probably one of the worst decisions that we could make. So keep things open, keep pushing the message of getting vaccinated. I'd have to disagree with my esteemed colleague Teslin. Let's stop making excuses. Get the vaccination, get boosted, do the right thing. I mean, the metrics we should be following in this is hospitalization rates and death rates. The fact that we have 71% of the country now fully vaccinated, 85% has received at least one shot, I think is reflective of how good things are going. Yes, Omicron numbers are up. That's going to happen. That's expected. But look at the death rates. I mean, now we're reporting the first death, unfortunate death because of Omicron. But we'd have thousands, tens of thousands of people dead right now if people would not have gotten their shot. So let's keep pushing that message of getting folks vaccinated and boosted.
Dale, for clarity,
Teslin, I know it's hard to argue with a man that has flashing lights in the background, but I also know you and know that you're going to do so. So go ahead, take it from there.
Yeah, well, it's not about disagreeing with me. I'm telling you like it is. It's not about what I would prefer or what I would want. This is what it is. And so you can continue to tell folks to get the shots. Of course, do that. Encourage that. But I do not support turning away one American from the other in the hospital based upon a vaccination. And so you don't have to disagree. The history shows what has happened with Black people in this country in regards to healthcare. So me, being a voice for Black people, cannot push one person not getting health care over another because we don't get it in the first place. And I, too, am a military person. And when I signed up to join the military, Dale, that was a volunteer decision. And it was voluntary that I got the shots when I was in the Air Force. This is something totally different. And we have to take into account that some people have religious preferences that others do not.